Hi, good evening, everyone, and welcome back to another episode of A Doctor's Insight. We're very happy that you're joining us today. And we have a very special guest. So, Dr. Jade is joining us today. And I'm just going to read a bit about her and then we'll get into the questions, everything about radiology and a bit more. So, Jade grew up in Bristol and moved to Manchester to study medicine with an intercalated neuroscience degree. She then moved to London for foundation training and is now a radiology registrar in Cambridge. Jade is the founder of Widening Participation Medics Network and co founder of RadReach. She is passionate about equity, diversity, and inclusion and sits on the British Society of Interventional Radiologists EDI committee and the Interventional Radiologist Juniors Committee as EDI lead. Jade enjoys gardening, cooking, and spin classes. And an interesting fact at university, Jade was the bassist in an all girls rock band and performed solo acoustic covers at a couple of open mic nights. So, thank you so much for joining us today, Dr. Jade.
It's great to be here.
So I just wanted to get started by asking you to tell me a bit about a typical week or a day in your life as a radiology registrar.
It's very, very varied as a radiology registrar, especially from each year ST1, ST2, and ST3, sort of the junior years is split into. And your day is sort of split into one morning and the afternoon session. And the sessions are a mix. So some of them are sort of general radiology, and that might include doing some ultrasound lists. And the ultrasound lists are like head to toe ultrasounds. Nothing is sort of themed. So you might be doing upper abdomen, and then you might have a pelvis, and then you might have a query lower limb DVT. So you do that scan as well. So it's very, very varied. So one session might be ultrasound, and then another session could be X-rays. So you'll be reporting lots of plain films, whether that's chest X-rays, X-ray of a foot, an X-ray looking for a foreign body somewhere. And then you also might have a CT session, and that's usually split into the inpatient. So it's all the really acute emergencies from A&E, or it might be from the wards or the surgical assessment unit. So those ones you want to get up quite quickly. And then the other sort of sessions that we have less frequently, but sort of pop in depending on which subspecialty area you're in, are MRIs. So when I was on gynae, I had quite like an MRI day. So Tuesday was all sort of MRI themed, and we got to go to the MDT and present some cases as well, so and get feedback from our consultants. And then it just sort of expands because radiology is huge. There's like the nuclear medicine side of it as well. So I just finished my breast and nuclear medicine section too.
So it sounds like there's a wide variety of skill sets that you need to do radiology. And you can go from one part of the body to imaging another part of the body. But do you find that there are more presentations that are more common than others? And if so, what are they?
Yeah, definitely. So for ultrasound, if we're doing the on-call ultrasound, lots of the common presentation seems to be sort of right upper quadrant pain or right lower quadrant pain. It seems to be quite broad on the request form. So quite often they're looking for cholecystitis and gallstones or appendicitis. So lots of the surgical abdomen we do ultrasound for. And then when it comes to x-rays, it's more broken bones or generalized shortness of breath, query, chest infection that we're looking for. But then we also have to look for all the other additional things that can cause sort of shortness of breath, which might be something like a very small pneumothorax that the patient might have, or it might be something a bit more generalized that they've had for a longer period of time. So it's looking at all the different aspects, not just the specific question that's asked of us. And then again, the other modalities like MRI and CT is completely varied as well.
And you spoke a bit about the information on the request form. And I guess I'm just asking this based on what I've heard as a medical student, because it
Yeah.
varies how much detail you're supposed to put on, but what is expected? Like, what do you expect when you see a request form come in?
Well, I think the ideal request form will have a question on it. So a really specific question of what you want to know, especially the CT scans, because you can just write up abdominal pain, but it doesn't give us that specific information of where the abdominal pain is, how long have they had it, because that might change the differential diagnosis, and we might be looking for something a bit more specific. And then what we like to do in the conclusion is then answer your specific question, and that means you get what you want from the scan. Because if you're really general and say abdominal pain, then my conclusion is going to be like, well, I haven't found a cause for this abdominal pain, which could be anywhere. Whereas if
Fair
you're
enough.
like query appendicitis on the ultrasound, then I'm going to see the patient. I will still look for other things, but then I know in my conclusion I'll probably be a lot more specific. If I've seen the appendix and it looks really big and aggressive, then I'll describe that. But if it's normal, I'll make sure I'd write normal appendix in the conclusion. So it's really easy for the person that refers it. They just need to look at the conclusion and be like, okay, I've got my answer.
Okay, so it's all about the question and then being specific for you.
Yeah,
Okay.
definitely.
And since there sounds like so much that you can do on a day as a radiology registrar, what do you find your favorite part about the specialty to be thus far?
I really like the practical skills and the practical aspects of it. So that can be from doing drainages like acidic drains for the abdomen, or it might be drainage of a big collection or abscess that someone has, and also doing the biopsy side. And then I did my interventional radiology. We almost have placements like every 3 months. We change which area of radiology we're in just because it's so huge and we've got lots to cover. But in my
Mm.
interventional radiology 3 months, we got to do lots of other sort of more practical skills. So interventional radiology, predominantly like pinhole surgery, but I managed to sort of travel through the vessels with wires and do lots of really cool things, like placing coils in vessels to block the blood supply to specific areas that you needed to block the blood supply to.
And you mentioned that there are different types of radiology. So there's
Yeah.
interventional, which you just spoke about, nuclear. What are some of the others?
Yeah, so pretty much it's a bit like surgery, I guess, when you can split it down to lots of the body systems.
Mm,
There's not a specifically saying like a subspecialty, but it's the area of radiology that lots of people may specialize in. So GI, so gastrointestinal is one of the big areas that we have lots of radiologists in, pediatrics as well. Breast is quite niche and tends to be in its own sort of center or area of the hospital, and sometimes you don't see the breast radiologist as much. But commonly in radiology, even if you have one of those specialist areas like musculoskeletal as well, when you're on call, you actually cover the whole body. So you're not just focusing on your specific little area that you've got that interest in. You're actually keeping it varied when it comes to doing the evening on calls as a consultant or the weekends as well.
okay, so I guess you still remain proficient in everything, but you're able
Yeah,
to pursue your interests more specifically.
exactly.
Yeah.
And it's a bit different in the like that's in the teaching hospital where I'm at now in Addenbrooke's, but also there's lots of district general hospitals and they tend to be like very, very generalized. So it's pretty amazing how much knowledge they have and all the things they can report.
It sounds like a lot. I mean, I personally haven't had a radiology placement in medical school, but just thinking about all of the things that can go wrong in the body, and
Yeah.
you guys have to image everything and try to figure it out is just, it's amazing. And on the flip side, what would be your least favorite part about the specialty?
I think for me, it's similar to what you were saying. There's so much to learn, which I love learning, but then it means in the exams, there's so much they can test you on. So I think, like
Mm.
most aspects, lots of people don't like the exams. I think that's one of the things for radiology. It's just so much to learn. It can be a bit overwhelming when it comes to doing the exams.
Hmm. But other than that, it's a great specialty to be part of. That's what I gather so far
Yeah,
from what you're saying.
definitely, definitely. There's lots of teaching, which is really nice because in lots of other specialties, especially in the early years, there's not that much teaching. And when you report an X-ray or when you report a CT, it's going to be checked and discussed with one of the consultants or senior registrars. So everything you do, you get sort of pretty instant feedback.
Mm. And generally, how long does it take to look at an image and then write up a report and send it to the um, consultant or doctor who's requested it?
Yeah, so it varies. So I had an ultrasound list this afternoon, and so we have 20-minute slots for you to do your ultrasound and also write the report, and then make the
Mm.
room all clean and tidy in between and everything. So it's pretty much that's how much time we get to do the ultrasound. But generally, just it will take a couple of minutes to write the actual report for the ultrasound, and the rest of the time is sort of introducing the patient to what you're going to be doing and getting consent and everything like that. So those can be quite quick, but then when you're reporting like a chest X-ray or an X-ray of like a leg, arm, or foot or something, that might only be like 2 minutes or so to have a look at the image. We always have like two images for the X-ray, so you get two views, unless it's a chest X-ray, and then you just tend to get one. And then you would write that within probably depends if you dictate, because luckily we can do lots of dictation, not all typing. It can
Mm.
take like a couple minutes to do those. But when I was looking at MRIs, or when I first looked at a CT, I think it took me half a day. Now it takes like 20 minutes,
Yeah.
depending on,
Okay.
the first time I did a CT, I think it literally took me half a day.
Because there's just so much to look at, isn't
Yeah,
there?
there's so much information you don't realize. And I was looking for like lots of pulmonary, like seeing if there's any pulmonary nodules, and then you scroll through the
Mm.
lungs, and then it takes forever, and then you suddenly get a lot quicker at spotting when there's an abnormality.
Well, that's great that it not only takes you like 20 minutes. That's a
Yeah,
big jump.
yeah.
And so how would you say, I know you're still in training, but how would you say the specialty has evolved from when you first started until currently?
I think probably like most specialties, COVID sort of changed the way people work. And with radiology, there's a lot more sort of flexibility in working from home for some of the consultants, depending on which areas they're in. So I think that's one of the areas that's changed quite significantly. But I've probably only been in radiology for coming up to 3 years now. So I haven't seen the biggest changes, but I think we'll see a lot more, especially with interventional radiology and pediatric interventional radiology and all the different amazing procedures that you can do. I think we'll see that bit expand quite a lot. And I think in the future, we'll see how AI can help radiologists to sort of get faster at doing writing lots of reports and getting the information out that we need and prioritizing different scans.
I know AI is the talk of the town for almost every specialty now, isn't
It
it?
is, it's thinking, how will it help?
Yeah,
And you,
exactly.
and you need
And
to be
making sure it's
involved.
beneficial.
Yeah,
Yeah.
exactly.
And I'm just curious, considering the importance of patient interaction and things,
Mm.
how beneficial do you think it is that consultants are able to report from home, or that's where they do the majority of their work now?
I think it is important. So I think some it depends on like if it's on call, then our and it's like the evening on calls, or so our consultants are all sort of in with us in the same reporting room usually, and we're able to talk through different cases. But I think with there's so much backlogs in radiology just because we're trying to push through so everyone gets their scan, and then once they get their scan, there's not enough radiologists. It's like
Hmm.
all specialties are short to report all of the scans, so those build up. So it's quite good that reporting from home allows different consultants to then work through at a quicker pace lots of what's on that backlog to get those results out to GPs and medical specialties and surgical specialties. So I think it
Hmm.
helps with the pace of things, but it's good to have your seniors around as well. So it's finding the right balance.
And I guess what you'll find is patients are either frustrated that it's taken too long to get an appointment for the scan, or it's taken too long to get the results. So there's no win-win situation, is there?
Exactly. Yeah.
Yeah. And is there any specific resource that you would recommend to a medical student or junior doctor who's interested in pursuing radiology?
I think there's quite a few different resources out there. Radiology Cafe is one of the best ones just for breaking it down, sort of what you need and the different stages and the pathway into radiology. So that one's really, really good. And then to find out about radiology in general, the RCR sometimes have a couple of sort of workshops slash events on throughout the year, and they have their conference. And then you've also got IR Juniors, who I'm part of, and that sort of introduces you to the world of interventional radiology and has a couple of conferences, and they try and make it really cheap for medical students as well to get more people to be able to make it more accessible really. And then there's also Radiopedia if there's something that you found out at med school or as junior doctor and you want to find out more about it. I think that's one of the best resources that is free, which is amazing they've been able to keep it free for everyone because there's a whole wealth of radiology knowledge in there. There's lots of different
Radiopedia,
resources.
yeah, Radiopedia definitely saved me during my ISKI prep
Yeah.
when I saw X-rays and had not one clue what was going on.
Exactly, it's an
But
amazing
yeah,
resource. But then also just like speak to people in the radiology department and just get to know people because they can give you little sort of nuggets and help along the way.
perfect. Okay. So it sounds like there's a lot of resources that people can choose from. It's just knowing where to find them.
Yeah, definitely.
Yeah. So now we're just moving into the section where we talk a bit about your career path, to where you are now. So can you tell us how you came to choose radiology?
I think it's quite funny. I sort of just like fell into it and then was like, oh, this fits, this feels right. Because at medical school, we had 2 days in Manchester for oncology and radiology, and we went to the Christie's Hospital, and that was sort of our only experience of radiology. And I remember they had lots of X-rays at the front, and we went through one by one trying to describe what we could see on the X-ray. And then that was everything. And we had PBL, problem-based learning. So there was a few sort of cases throughout the first few years where you might then look up a little bit on chest x-rays, for example. But there wasn't that much formal teaching. And when you're on the wards and ward rounds, you might see like an occasional like x-ray or a bit of a CT. And then, because I didn't think about it at medical school, and then I got into F1 and F2, and I did there was like one of those quizzes that you do online, like which specialties do you choose? I think the BMA had ones called Psi 59, I think it was called at the time. And so I did that one, and it was interesting. Radiology came up quite high, and so did clinical neurophysiology, which I didn't really realize was a specialty at the time. So I did a taster week in both of those, one in F1 and one in F2. And I was like, oh, radiology is really interesting. And it was like I realized I looked back in F1 I had respiratory first, and I was like, oh, I quite liked looking at the CTs. We had one consultant that was really, really good, and he would point things out to us, one of our respiratory consultants. And I was like, that bit was really interesting. And then obs and gynae, I realized I liked looking at the ultrasounds. I sometimes went with the patients for their ultrasounds when we had time. And I was like, oh, I quite like that aspect. And I was starting to realize different aspects throughout the way was all radiology. And then my taste week sort of confirmed it for me. And then that's how I thought I'll apply. I don't know if I'll get in, but I'll apply. And I applied to another two jobs at the same time because I wasn't sure if I'd get in at the time. And then I sort of got in, and I really enjoyed ST1. It was really good, and I'm still enjoying it now. So it's a bonus.
Sounds like you made a great choice then.
Yeah, definitely.
And can you hazard a guess as to why radiology is not taught extensively in the medical school curricula?
I think it's deciding how you're going to sort of match it to what the curriculum already is. So I think you can't just have radiology on its own as a placement because it fits so well within everything. Like every time a patient comes into hospital, the majority of patients at some point in their journey is going to have some form of imaging. So I think the best way to manage to fit it into the curriculum is having it throughout lots of the different modules. Like there's so much surgery that overlaps with radiology, and so many, all the medical specialties pretty much overlap with radiology. So I think it's fitting it in throughout the year so you keep returning to it, and that helps you sort of build on your knowledge. Whereas I understand it's quite hard to fit anything else really in the medical curriculum. So saying you're going to have 4 months of radiology is not really going to probably work for the majority of medical schools. But it's just finding a way to put it through so it's always themed, and you're thinking about pathology, you're thinking about radiology, and all the other aspects that are intertwined.
So it's not probably practical to make it a part on its own, but maybe intertwining it a bit more into the different placements we have could be a bit more beneficial.
Yeah, I think that would be sort of better and help you to remember it as well.
Yeah. Okay. And what are the training pathways like in radiology?
Yeah, so it's quite different. So there's two sort of styles. There's like the more traditional sort of course, a bit like having the traditional and problem-based learning is similar to that. But then there's also the academy as well. So the one I'm doing is more traditional. You start, and in your first few weeks, you're looking at the list, you're reporting x-rays, you're in the ultrasound department, you started doing ultrasounds with supervision and someone teaching you. And then there's the academy where it's more you're given some cold cases, so things that have already been reported, collected specifically, and then you work through those, and then you get taught a lot more sort of lecture styles on how to do radiology and how to improve, and you get feedback on those. So you sort of develop in two different ways, two different styles of learning, and it really depends on what your preference is. I think throughout medical school you sort of find out what you like better and what sort of learning style suits you. But it's very, very varied between the different training schemes. In Addenbrooke's, Cambridge, we spend 3 months in Luton, 3 months in West Suffolk, and all the rest of the time at Addenbrooke's rotating through those different areas, like I said, like MSK, GI, breast, nuclear, just for, to name some of them. And also we go to Papworth, which is just next door now, for all our chest imaging as well.
Okay. And the next question that I have is, can you give us some insight into both the professional and personal sacrifices to be mindful of when pursuing radiology as a specialty?
So I think personal, it's probably one of the better specialties depending on which area you choose to try and keep a good work-life balance. So I think that's definitely a positive side of radiology. And like I said, it does depend on what you decide to go into, which area of radiology. So it can vary quite a lot, but I think it is quite good still at the moment. And I think professional, I think it's just like all of the other specialties, to be honest, it's not one on its own, but it's thinking of the structure of how it works. So ST1 is very, very good. It's usually very well supported. Sometimes you do on calls, but at Addenbrooke's we didn't do any on calls, so that was quite nice. And then you suddenly get into your exams at ST1, which is different because for lots of surgical and medical specialties, some people do their exams during foundation years, so it's a little bit different. We sort of wait on until ST1, and then
Mm,
it's quite intense for the first few years. Then you have another exam in ST3, another one at ST4, but then you've finished because radiology training is 5 years if you're full time, and intervention is 6 years. So it's actually very, very quick, and there's a lot to learn in quite a short span of time. But
mm.
you do get through it, and you have supportive colleagues, so it's sort of doing it together, which makes it a lot easier.
And what is the work-life balance like in terms of working hours? So is it, I know when you're going through your training, you may have the on-calls, as you said, which is a bit more intense. But when you
Yeah.
get to a more senior level, what's it like then?
So we do 2 weekends every 13 weeks is sort of the what we do at Edinburgh, but it's different everywhere. And then we do evening on calls as well. And the senior, so when you get from ST4 and ST5, they also do nights then, so it gets a little bit more intense as you go up because we don't do nights as ST1 to 3 in Edinburgh's. And then as a consultant, it's a bit varied because if you're interventional radiologist, you might be in several times throughout the night doing cases. If you're a diagnostic radiologist, it might be a bit different in that you might get called to look at a CT at home, but then you're unlikely to come in, but you might come in for some of the pediatric work that we do.
Okay. So it's just based on what specialty um, you decide to get into that will dictate that.
Yeah,
Well,
definitely.
subspecialty, yeah.
Yeah.
Okay. And from your perspective, what are the most important factors to consider when committing to any specialty? And this kind of links into our featured question that a guest has a chance to ask. Well, I'll listen to what you say now first.
Sure. So I think it's mainly choosing something that you makes you happy and something that you're interested in because you are going to be doing it most likely for a long period of time. And it's easy to rush into something or think that one's easier, so I want to do it. But if you don't enjoy it, you're just not going to have that much fun throughout your career. And it's when you're really interested in something, I think you're a lot more motivated. So it takes a while to figure out what you want to do, but give yourself that time. Even if everyone around you has their mind set on something, it's okay to be the person that doesn't really know yet because you can take F3s, F4s, you can take a break if you need to, you can swap specialties, nothing's set in stone. But just find out what makes you happy and what you enjoy.
I think that's quite a popular response amongst the guests I've had so far. I think it can be so easy to try to rush into things and get overwhelmed when you're not close to making a decision as someone else or another peer. But it's all
Yeah,
about just taking time to find what you're passionate about. That's really important.
definitely.
Yeah. And now we come to the advice portion of the podcast. So, the first question is, what would you say to any medical student or junior doctor who may feel a bit overwhelmed at their career path or the future, what it looks like?
I think most people feel overwhelmed at some point along their career path, and I think the first thing to do is to step back and look how far you've come, because we don't realize sometimes that we've overcome so many different hurdles to get to where we are today. And if that's something you need to just like think about or something you need to write down and have there just to remind you, I think that could be really, really useful. And I think it's just you can have that big goal of where you want to be, but just take small little steps and figure out what those steps are that you need to take to get there. And there will be ups and downs. It's generally a roller coaster for most people, even if it looks like everyone else is just flying or just like plain sailing, and you're there like with your feet under the water trying to keep up.
Like a
But
swan.
exactly, exactly. But most people, it's I don't know anyone, none of my friends or anyone I know that's just found it easy all the way through. So take a step back, take a breath, make sure when you're feeling overwhelmed, you're still doing things that you enjoy and your hobbies to some extent, and you're like eating healthy, trying to do a bit of exercise and keeping up with just your like mental health and physical health is like the most important thing. And once you get that in line, and then you can sort of focus on what else you want to achieve, but you'll get there. It's just different path to others often.
Yeah, and I think it's also important to reflect on the fact that it's not always just one upward trajectory. Like as you said, it's a roller coaster. They're going to be waves, and it's anticipating when the next, trough is going to be, and just being okay with that because there's a peak that's coming next.
Yeah, exactly,
Yeah.
definitely.
And thinking back, what would you have done differently, if anything, and what would you have done the same in your journey to becoming a radiology registrar?
I think probably one of the things I still don't know if I would definitely have done it differently, but having an F3, I think it's a great time to just reset and travel and do things you want to do. My F3 would have fallen during COVID, so I think that would have been a bit tricky. But now I'm just like, oh, I want to go traveling for a while. So I didn't have like a formal gap year. When I was 18, I had a year before medical school, but I was working for the full time for the whole time. And then it went straight from medical school to F1 to F2, straight to radiology. So I think I would have liked to probably travel a bit more, but that just means I'm going to travel more later at some point.
That is
So
true. And you get to go wherever you want.
exactly.
And okay, so now the closing question, and then we'll move on to the featured questions that the guests just send in. So, what is the best piece of advice that you have been given that has shaped you as a clinician?
I think that's a hard one. I think lots of the times you hear little sort of nuggets and then you don't realize that actually changes your journey or where you want to go. But I think it's similar to sort of the advice I gave, but it was when my supervisor said you just need to make sure you're looking after you. I think that's really, really important because I think that's sometimes very, very easy to forget when we've got a lot going on, and making sure you're just enjoying life and enjoying the journey, because we often have this destination in mind and then you're just like trying to get there as fast as you can and you're forgetting that like, this is the youngest you're ever going to be. Just enjoy it.
Yeah, exactly. Just enjoy it. Take your time.
Yeah.
It's like when we said we wanted to be teenagers and then we became teenagers. I
I
was like,
know.
slow
Yeah,
down a bit.
exactly. It goes
Um,
faster and faster.
exactly. And so the first featured question, I usually choose one, but I couldn't this time because I found both quite interesting. So this person wants to know, what is the personality trait that's most common among radiologists? And I'm assuming that this was sent in because there's this thing that certain
Yeah.
personalities suit certain
Yeah.
specialties.
There's definitely a stereotype about this like radiologist in a dark room that like shouts at anyone that comes anywhere near them, but it's really not the case. You might meet like one person like that, but it's really not the case. I think the personalities are so varied, especially I'm thinking of like the registrars and the consultants, and it's very, very variable. I don't think I could pick like a specific personality trait. We've got some really, really quiet people, but then we've got some real like extroverts, and then you've got some really sort of, it's just complete opposites I can think of. I'm picturing specific consultants and registrars now, but I'll name no names. But it's very, very varied. But it's nice to work in a team that's that varied. I think the nice thing about radiology is that anyone's just happy for you to go and ask them a question like at any time. And it's a really, really friendly environment. I think from when you're from the outside, if you're not within radiology, I think it might seem a bit intimidating at the time, because the radiologist is probably answering your question and then within 30 seconds they're answering another question on the phone, especially when that's when you interact with the radiologist the most. But when you're actually in the department, I think it can be quite different to when you're on the phone asking about a scan when you don't know the patient, and then the radiologist is getting annoyed because you don't know the patient, you haven't
Yeah,
seen them. So
which is
it's
what we hear
completely
about
different.
so often.
Yeah, definitely.
So do you think, just putting a pin in that point, do you think that frustration comes from the lack of familiarity that the doctor on the other side of the phone has with that patient?
I think that often can be the case. I think
Mm.
when someone's, sometimes you get like a CT and it just says something very, very vague, and then you look in the notes. We're lucky that we're able to see a bit more in the notes, and with our computer system we find out like this operation that they've had, and that like sometimes they've had query appendicitis but they've had their appendix out, and it's like, well, that's not very helpful.
Not at
So
all.
yeah. Or sometimes
Okay.
they've just had a recent surgery, but they haven't put that on the request. And then you're looking at the scan, you're like, oh no, what? Is something perforated? Is there, why is there lots of like gas everywhere in the abdomen? And
Yeah.
then they don't write like the really basic thing that they're this many days post surgery. So I think it's just working together a bit more. But on the flip side, that doctor has probably got such a long list of patients, they're probably getting confused and haven't been told by the person that's handed over to them what they need to know. So it just gets very, very difficult when there's miscommunication.
Hmm. And just interested to know, is there like a criteria or a checklist that was produced by radiologists that can probably assist doctors when they're requesting certain imaging and things?
I don't think there's anything specific like nationally. I think locally there might be a bit more guidance. And then I think
Okay.
Radiology Cafe did have something before. I don't know if it's still on the website. And it was quite useful of just how to like what to put in the request and the key important things to know, like if you want your patient to have a procedure, blood tests that need to be done beforehand and things, just to
Mm,
make that sort of conversation a lot easier.
okay. So I guess that information just needs to be disseminated a bit more widely.
Yeah, I
Yeah.
think so.
And now for the final question. So, what is the most interesting case that comes to mind for you?
Oh, there's honestly so many. It's hard to choose. I think one of them was probably seeing my first ever portal vein embolization. So I was in the interventional radiology suite, and I didn't know that this procedure existed before. So for me, it was like something completely new and novel. But there was a patient with a cancer in one side of their liver, and the aim was to block the blood flow to that side of the liver. So the other side grew big enough that they could remove the other lobe of the liver that had the cancer in, and then they'll be treated. And I was just like, that's amazing. I've never heard of that before.
Wow.
I didn't know that was a thing. Like, no one taught me
Yeah.
at medical school or family medicine years, but here it's that amazing procedure. And then there's other ones in interventional radiology where someone had a ruptured aneurysm and they managed to, so the interventional radiologist through a small hole in the groin went straight to the into the artery and they managed to save the person's life and the patient was awake whilst they were having this. There was anaesthetist there and they were slightly sedated, but they were awake and it was pretty impressive to watch that happen.
Wow. So,
Yeah,
like, as you said, it's such a wide variety of things you can see.
yeah, definitely.
That is, wow, that's amazing. Um, and we always see jokes and things about radiology, imaging, like X-rays of foreign bodies. Is that actually as common as people make it seem, or not really?
It's not as common, but I think when you see them, then you remember them.
So they are
So
weird
you'll
and
probably,
wonderful then.
yeah, there are definitely weird and wonderful things.
Okay,
Uh,
but probably just like TV shows just exaggerate it a
yeah,
bit.
I think they make it to be the main thing that we do as
Yeah.
radiologists.
I remember when I was in high school and I used to just watch like doctor pictures and things and I
Yeah,
used to see it. And as you said, it's the only thing that they show radiologists like looking at, which
yeah,
is kind of strange, but gladly that's not all that you do or all that
yeah.
you
There are
see.
additional, there are extras.
Yeah. Well, that brings us to the end of the podcast. And I just want to thank you so much for speaking to me today. I had a wealth of knowledge given to me about radiology, and I hope all of the listeners did as well. So thank you so much.
Thank you for having me.